Welcome back. Now, like most viruses, COVID-19 is mutating. With little known about the virus itself and new variants being detected, how much of an impact does this have on vaccine hesitancy? Tessa Dooms from COVID Comms speaks to us from Split in Croatia now, and it's an important conversation. Tessa, thank you for your time and good morning to you. That's the question. I mean, when we see more of the variants coming up and, you know, the mutations that the NICD was just telling us about, how much of this is causing or impacting on hesitancy, or at least vaccine hesitancy?
Good morning. We would hope that the identification of new variants would actually be a stimulant for people to see how important it is for us to get the vaccine. We know that all of the types of vaccines at the moment have been found to be somewhat in different variations being seen to be effective and protective against COVID-19. And we're also knowing that the longer we wait for a population to get vaccinated, the more variants are actually able to emerge, because the virus is out there and the virus is able to mutate as it goes from person to person. So we would hope that more variants would mean that people would see the urgency in getting vaccinated. But the opposite is, of course, also true, where we see that people feel like, well, you know, there's a new variant all the time. It doesn't, you know, the rest of the world is getting vaccinated, and then they end up back in lockdowns because of new variants and people not being sure that, you know, the new variant isn't going to, you know, have a devastating effect on population. So it may just cause the sense of hopelessness for people saying, you know, even if we get vaccinated, this thing is not going away, so why bother? And that would be the biggest concern around new variants and their impact on people wanting to take the vaccine.
You make such an important point there, Tessa, but also at the same time, I'm sure you would agree that, you know, part of an effective vaccine program or rollout program is communication. It's how, you know, the reality or the facts around the vaccine and also the virus are communicated to people so they can make more of an informed decision. And I suppose my question to you is, how much of an impact will this mutation, this new variant also have on COVID communications?
Yeah, definitely we've had a bit of a communications meltdown in the country over the last several months. And at a time where we really need to be communicating much more about the vaccine and the scientific information around the vaccine that we have as a country, particularly because the disinformation and the misinformation machinery globally has been able to infiltrate South African spaces, and people are getting many different messages about why not to take the vaccine. And so it would be useful for government, for civil society, to all have very strong messaging, particularly that pushes the science. And I think there are two things that we definitely need to do more of in the country in a messaging capacity. The one is get actual scientists and healthcare workers particularly to talk more about the vaccine. I think people need to hear local scientists and local healthcare workers that they know and trust speaking about this vaccine, and not only have the vaccine be something that comes from outside in. And also we need to hear from people who have been vaccinated. We've now got over 10 million people in the country who have at least one COVID-19 vaccine shot. So hearing from those people about their experiences, particularly countering this narrative that COVID-19 vaccines cause death and cause serious illness. I think that narrative can only be countered by hearing from people who have the vaccine, who we can see around us. But what we are seeing is that people do need good information. They need information in their local languages. They need information and places where we can have conversations about COVID-19 and people's questions can be answered. Because as new variants come up and as the science changes, it's even more need for us to make sure that good information and up-to-date information is shared with people so it does not cause more and more hesitancy.
Yeah, in literally a matter of seconds, in the last 20 seconds I have with you, Tessa, if you may keep it brief and short, please. Do you think besides vaccine hesitancy, we might see a lot more COVID fatigue as well?
Yeah, we've been seeing COVID fatigue for a while. And I think the other part of the messaging that has been missing is the idea that COVID isn't something that we're just going to get over. It's something that we're going to have to learn to manage and live with. and that vaccines are part of that management and living with COVID-19 until we have a population immunity where we can get COVID and have cases not be as serious. And we've seen it in other countries where you have high vaccination rates, that people still do get infected, but the incidence of hospitalizations and deaths are very low, which means we can live with COVID-19. That's the message.
We have to leave it there, but thank you for speaking to us, Tessa Dooms from COVID Comms.